Dr. Noah, and it's Health Update, and so I've gone through the scientific research and kind of bring you up to date what's happening here. This is disturbing, and the little plug, Veterans Day is coming up in the next week. I volunteer at the Pathway Home, and if you could go to their website, and we'll have that link for you. I mean, this is a a program that helps with post-traumatic stress disorder, traumatic brain injury. These are soldiers that have, and Afghan and Iraqi soldiers that had some type of major type of physical type of problem, like working with a Navy SEAL, that hand grenade was blown up his fingers and his arm like that. So it's pretty bad stuff. And they're always looking for some type of money like that. So it's the pathwayhome.org. Check it out. Donations would be great. Once again, I volunteer. I make no money off of this, and so that's a great thing. But follow up on that. Deaths from painkiller overdose triples. There's been a 300% increase in terms of using these drugs like Vicodin, Methadone, OxyContin, like that. And how much leads to how many deaths a year? 15,000 deaths per year. So this is a dangerous type of drug. It's given out like candy. These soldiers are giving it to it like that candy, and it's just devastating. These are narcotic type of compounds. These become addictive. These kill people. And when there's other alternatives, when I treat the patients, or these soldiers there, they get benefits without having that. So this is alarming. So these states here, such painkillers are meant to help people who have severe pain. I don't see that. People that have women have menstrual cramps, they're given the Vicodin. They have, they fall down and they hurt themselves playing basketball. Sure, pain's no fun. There's other alternatives which we talked about that have actually been equal to some of these type of compounds. Very, very devastating. So this was kind of an interesting study that most addicts get painkillers from friends and family, not doctors. This is what they do. They go to their doctor, they have in their medicine cabinet all this kind of crap in there, and then they start giving out to their friends. Like, this is like you giving heroin out to your friends or kids and stuff. Vicodin and some of these drugs are the big black market things in colleges. This is where all the kids are, going into their mom and dad's medicine cabinet, ripping all these things, charging $5 to $10 a pill, and hooking these young people. Devastating, devastating. And just a little reminder, Health and Human Services 2 months ago, there's one death every 3 minutes because of, drugs, medical procedures. So that's how dangerous this stuff is. Breast cancer and bacteria. So this was kind of interesting, is that they're finding out that your intestinal gut is a big factor in terms of what happens in terms of your overall immune system and whether or not you're prone to cancer. So when you eat crappy food, you take antibiotics to change the intestinal flora. We talked about the study just a couple months ago that one time on antibiotics change your good and bacterial for life. And so that's the battle that you're up against, just taking it once. Very, very type of factors. We are studying the different kinds of bacteria in the gut and trying to identify their metabolism in relationship to disease. And in this study here showed that there was a direct correlation in terms of breast cancer. So what your gut is. The reason why I bring that up because back in the early 20th century and late 19th century, your colon was the big deal. And I always have people, colon cleanses and your gut like that, that's all foo-foo. No, it's not foo-foo. It's real science. The science now supporting it is a big factor in terms of your health and well-being. You don't have drug deficiencies. You have basically improper type of imbalances with your gut. Little case update here. Canadian measles outbreak hits the vaccinated people abound. And so once again, this kind of, almost fantasy of, just because you're vaccinated that you're covered is not the case. And so Canada has been experiencing a large mussel outbreak. More than half the cases have been among people who have been fully vaccinated. So this type of notion that you become vaccinated, you're 100% covered is not the case. So now more and more studies are showing is that that's not fit or not factual. Gym versus genes, how exercise trumps obesity genes. Now that's the big, thing going out now. Oh, I'm fat because I have fat genes. Well, there are some, in terms of interest, in terms there are some certain fat genes, but it's only 10% of why you're fat. I mean, that's what they forget to basically, tell you. So what you need to do is, take drugs or have surgery because poor you have these fat genes and there's nothing you can do. Well, in this study here from the Institute of Metabolic Sciences showed that that's not the case, that exercise is able to either downregulate, turn off your fat genes, and turn on different type of metabolism. So this victimization has a purpose. When you're, once again, you're a certain type of approach, well, take this drug, have this surgery, because poor you have no control over your health because you have these bad genes, is, once again, not factual, it's voodoo, it's called epigenetics, that's the cutting edge, is that your environment controls your genes, not this helpless type of thinking that because you were born with these genes, you're always going to be like that. This was kind of big in the news here. Alcohol, kind of a mixed type of bag here. Alcohol has been shown to help with heart disease and other types of benefits, part of the Mediterranean diet. Well, with breast cancer, another new study just came out that those women who drink 3 to 6 glasses per week increase their chances of breast cancer by 15%. So it's a tough call there in terms of what we're doing now. There's other factors that you can do to reduce breast cancer in terms of lifestyle, which we talked about. Those women who drank 3 glasses or less per week had 0% increase. And that wasn't just wine, it was beer, any type of alcohol there, and that was published in New England Journal of Medicine, October 2011. Steve Jobs, just recently passed away. There's big controversy about, he started naturally in terms of, trying to become he became a vegan diet and he did herbs and acupuncture, and because of that stupid type of attitude, that's why he died. Well, that's not the case. Here from Dr. Dean Ornish, prominent professor at University of California, San Francisco, stated that, probably that there was, by the time they discovered, because they found it by mistake. It was another type of CT scan. They found a mistake, and that, as they stated here, is that most of the time that's already metastasized, over 60% of the people. Dr. Lubetti from Einstein Cancer said, from what he was able to say is that, what happened to Steve Jobs just happened. It had nothing to do about, having to go rush in. He had the surgery done 6 months later. That 6 months had no real window in terms of whether or not he'd still be alive. But it's a way for, the allopathic to saying, well, see, never try alternative things. Always do this stuff because, we got the answers. They don't have the answers. 5-year survival for that is 5%. So that's the best that they have to offer, in terms of that. And he lived, what? 2003, he had the CT scan. It's 2011, he lived 7 years. I would contend, and I have studies to support it, because he went vegan, he had like that, that's why he did live as long as he did. If he didn't do that and just did the surgery 6 months later after like that, he'd been dead earlier, just as the statistics show. Johnson & Johnson baby shampoo, which is kind of sad, has a particular chemical that releases formaldehyde. Now, when I went to school back a number of years ago in the cadaver labs, one of the carcinogenic compounds that we were exposed to, which was very little type of protection there, is formaldehyde. It's known as a class carcinogen, causes cancer. What's it doing in baby shampoo? And so there's a recall. People are trying to petition that. And Johnson & Johnson says they're trying to do it. They've been trying to take it out. Hey, just take it out. I mean, that's crazy. Sugar drinks, once again, Yale study showed that 64% of children drink all this crap. So it doesn't have to be soda, fruit juices, energy drinks. We've talked about all these high sugar type of content drinks, increased type 2 diabetes. It's just not good. Don't go there. Good mood increases longevity. This is from Science, October 2011, University of College of London, showing that people with good mood, once again, 35% less die in 5 years. So good moods, increase your chances of living longer. Plus, it's just a better way to live your life, to be happy. You have a choice. I mean, it's the facial muscles. When you cry and you're angry like that, you use like twice as many muscles than when you're smiling and happy. So how about living longer? So that's a good one. Back to red wine, resveratrol for the first time. Now, resveratrol has been a big hot thing. In terms, it's one of only 3 or 4 things that have been shown to increase longevity. but they have not done the clinical trials in humans, and now they have. And in this study here in Cell Metabolism, October 2011, showing for the first time that 1 month obese patients were able to actually change their metabolism with 150 milligrams of resveratrol. So that's something that, once again, another type of nutrient that you could add, to your diet. I happen to take it because I think it's pretty hot, and so that's an important factor. Let's see. This is an interesting one. In terms of high cost of the economy, in terms of everything. Well, healthcare or sick care is very expensive. It's $2 trillion. Gee, Harvard study showed that doctors are kind of doing surgery when they really shouldn't do it on elderly people. They're on their way out, and they go out and they do $100,000 type of surgeries, and guess what? There's no science to support that has any benefit. It's just, once again, a big ripoff. And I didn't say this. Harvard Medical School did. Number 2 in the United States in terms of research. So it's not my agenda. Health Affairs, October 2011, saying, hey, this is nuts. 10% of the people in their last month are doing surgery. That's crazy. 35% of these elderly people, knowing that they're on hospice, ready to go, are having surgery. I mean, once again, surgery is not free, and as the study showed, that actually that could be the causative factor why they died earlier, because it's a very stressful thing. So that's the story. Don't blame me. Blame Harvard Medical School, saying that that this is outrageous. This is a big ripoff. That the hospitals and drug doctors and surgeons are doing surgery that aren't necessary and costing billions of dollars. Freshman 15, kind of a little type of thinking that when students go on to college or away from home, they eat a lot of junk food, they gain 15 pounds. Now, in this study here, which was kind of funny, they thought, well, it wasn't 15 pounds, it was 3.5 pounds. Well, that's not good either. As one of the scientists stated here in Social Science Quarterly, December 2011, I'm in the future here. Here it is, November, and they're talking about a study that's coming out in December, showing us that you don't want to gain 1 pound per month. We got a problem with obesity and overweight. So it was kind of a funny thing. It's showing, okay, well, they don't gain 15 pounds. It was only 3.5 pounds. Well, that's not good either. So let's see. This is an interesting one. Organ transplants increase cancer by 200% because they use immune suppressing type of drugs. When you get an organ, a transplant, they have to put you on drugs that prevent that from rejecting, and that increases your chances of cancer. And I bring that up because people don't realize a lot of drugs cause most of these organ decreases. Now, they did talk about hepatitis C, which is another thing that we'll talk about another time, is a big factor in terms of that. And drugs cause a lot of organ failure, cost hundreds of thousands, millions of dollars to do, and now we just show that it increases your chances of cancer by 200%. And the last thing is that these superbugs are becoming a big deal. 50% of the ICU units, those are where intensive care units like that, have superbugs in them. And that's a big concern. So that's where you get these diseases. That's where you can die from the disease. You're already critically ill, and now these bugs are in there because of misuse of antibiotics. So that's a little update.